This is even bigger than fib-hemi, but we're going to cram it all in. So, CFD is also very rare. The studies say that it's anywhere from 1 in 50,000 to 1 in 200,000, but the more severe the phenotype, so the worse the deformity, the bilaterals, those are going to be much more rare. So if you're getting into like bilateral non-ossified necks or bilateral type 3s, you're like up in the 1 in multi-millions sort of categories. But there's all different flavors between the bilaterals, between the unilaterals. And again, you can have as minimal as a kid who's got a pretty normal looking femur. It's just a little short, maybe some valgus, to like, what the heck is this? So in terms of the genetics, again, this is thought to primarily be spontaneous somatic mutations. As far as I am aware, there is one known case of a unilateral CFD hereditary, like mother and child. There are some known genetic anomalies, though, that go along with this. And so there are some syndromes that carry sort of fibular hemimelia type things, and they get shortening of the femur. There's femoral fibular ulnar complex, patellar aplasia or patellar hypoplasia often has shortening of the femur. Femoral deficiency with unusual facies is another one that we see. And then Pierre-Robin sequence also, which is a microfacial, craniofacial abnormality that comes in with femoral shortening and abnormality. Bilateral CFD, just like bilateral anything, is much more likely to be familial. This is a case of a mother and a child who have bilateral type 1A4, which is bilateral delta femurs. And I'll show you some x-rays of those. There's some supportive teratogenic causes.